Hi everybody, it's Dr. Missy. We're actually going to do a special class. This is not class number 5 about how to wear a mask and how not to wear a mask, because I had some developments last night that I think make this class even more important. So this is class number 6. We're going to get back to class number 5 in a day or two, but I just felt like I needed to share this one with you. Last night, around 7 o'clock, my cough went dry, and I had gone from Phil getting a lot of junk out of me just 2 hours earlier, and then my cough went completely dry, and I tried and I tried and I tried, but my cough was dry. And I measured my temperature, and I had the highest temperature so far. It was 100.2. And so thankfully I know that that means that probably there are mucus plugs where that mucus that's running through the bronchial tubes actually gets plugged off, like a cork gets put in there and it can't come out. And so for me, the cough was dry. For my body, my lungs were getting wetter and wetter and wetter, and so my temperature was rising. So anyway, I didn't take Tylenol for the temperature. I wanted to know how high it was going to get. But instead, a couple of friends, Carrie and Bob, I was in touch with several friends during this, I'm not doing this on my own, recommended that Mucinex would be a very good thing to use. And so I went ahead, even though I've been afraid to take anything at all. You know, they tell us that steroids are really bad in this condition. They tell us that even ibuprofen is bad in this condition. So I've been reluctant to take anything. I mean, nothing. So I went ahead because I knew my condition was actually turning bad fast, even though I had a dry cough. Because my temperature was rising, I knew there was something wrong. And with this virus, we know it affects the respiratory system. So there had to be something going on in my respiratory system that was worsening for my temperature to climb. Anyway, I took the Mucinex, which frankly was a horse pill. I could barely get it down. I don't swallow pills easily anyway, but I mean, that thing was big. It was a Mucinex DM. D as in dog, M as in mom. And that's the Mucinex dextromethorphan. So that's both the Mucinex, which is it makes the mucus in your body, especially in your lungs, get really slick, super watery. And the DM makes it so you don't cough that often, because I was like coughing every 10 seconds with the dry cough, but nothing was coming up. My throat was hurting. I was hurting through here. I was thinking, gosh, if I do this for an hour, I'm going to have severe bronchitis, which is where the bronch tubes, those big tubes I showed you, they actually get really inflamed and painful, and that can add to yet another problem. Anyway, so I took one Mucinex DM and I drank one big glass of water, just right off the get-go. Then I got another big glass of water and I went into the shower. I knew it was I went into the bathroom. I pulled the shower on. I didn't get in the shower. I just left my clothes on, sat on the toilet seat, just sat there for, I don't know, it probably took 10 or 15 minutes, and the bathroom just filled up with all this hot, humid air. The mirrors started completely fogging shut. I left the fan off so the bathroom would just collect all this nasty, humid air, like I was in a not a sauna, but a wet steam room. Okay, so I put myself in a steam room. And within about 15 minutes, I just sat there. I just sat there and I started doing my breathing exercises. I felt like panicking, but I decided, you know, I got to give the medicine 15, 30 minutes. If it doesn't work within an hour, I was probably going to actually go to the hospital, because I knew that I had just been given the message that my condition was about to get very bad. You can't live with plugged lungs. I mean, come on. I already told you can't have water in there. How would you live if the lungs were plugged off? It's ridiculous. Nobody can live like that. So anyway, I sat in there, and thankfully I didn't have to wait an hour. I didn't even have to wait 30 minutes. Within about 10 or 15 minutes, I started having a cough, and it started rumbling. Didn't get anything up, but actually started rumbling again. It was not dry. I kept drinking that water, kept drinking that water. I can't drink, you know, 2 big old things of water like that. So I drank about half of that second water, and the first, sorry, this is gross. I'm gonna talk a lot about sputum now. The first thing came up, and it was about a tablespoon. It was like the most I'd ever coughed up, so I'm assuming that was a plug. Anyway, I sat in there for 10, 15 minutes. But remember, when I was sitting there and nothing was happening, I was doing those breathing exercises that I told you, which is I was trying to calm myself down, for one. I was getting scared, which was breathe out through my mouth, I mean, have you heard me breathe that well since I even started making these videos? I know you haven't. It's a miracle. I mean, seriously, I can't even tell you. I don't know why it came to me that it's about our lungs, and it's about wet lungs, and the virus will get killed if we just cough it up and do the drumming to get it out if we can't cough it up and all that kind of stuff. But anyway, it came to me, and I'm grateful that it came to me. Please don't hate on me. I feel like it came to me from God. I don't have an explanation for it, but I just kept praying. I've been praying so much these past couple of weeks to help my friends in Italy and my family in Germany, and just so many, you know, everyone here. And anyway, it started coming up and coming up. I was doing those breathing exercises. I probably did that for about 15 minutes, kept drinking on that water, and then it just felt like I had done all I could do. Like I was breathing like I just did for you now, and I really wasn't coming up with anything, but I thought, you know, it's been plugged for 2 whole hours, and my session 2 hours ago was voluminous, high quantity coughing crap up. So I felt like I had released the plugs, but there was a whole bunch of crap in there. So I had Phil come in, and he worked on me on the bed here with the drumming technique on the lower rib cage. Because I had been so bad, I had him also come across my sternum and up here. And I also had him come not just down on the lower ribs, but all the way to the top of the armpits. And every place he came, if I coughed or gagged, he would go kind of softer, because sometimes it'll actually, if you're releasing that much, it'll take your breath away, and you have to have them stop, or they'll choke you